And now we get the privilege of being inside an examining room with one of his patients who's going to even explain to us a little bit more about all what you've been viewing so far. Dr. Capicotto, tell us a little bit about your patient and introduce her.
This is Cheryl Weidman. Cheryl is a certified nursing assistant, and she suffered an injury to her lumbar spine with a disc herniation at the bottom level, which we call L5S1.
And we were talking a little bit earlier, and you were telling me about all the things that you did before you actually came to Dr. Capicotto. So tell me a little bit about your injury and what was happening.
I just had a lot of pain from the accident, and I went to physical therapy. I had a chiropractor and injections to my back, which none of them.
And none of it was helping.
No.
You were still in pain?
Yes.
Yeah, and doctor had said that you were having trouble sleeping, walking, doing anything.
Right,
just about.
right.
And then what happened?
I had surgery.
Yeah. Tell us a little bit about that. When she came to you, how did that all come about?
Well, I had actually treated Cheryl a number of years ago for another injury, and different from her present injury. And when she came to me, she was in pretty dire straits. She said she had severe pain, was not able to work. She couldn't sit for periods of time, couldn't stand, couldn't sleep at night, and all the non-operative or conservative methods of treatment didn't work. So we went on the direction of a surgical direction, and the alternatives were to do the classic operation of doing a spinal fusion with rods and screws, or using the more new technology and performing an artificial disc replacement. And Cheryl's a young lady, and she wants to stay active and busy, and she chose an artificial disc replacement as an alternative to a spinal fusion.
And I think that you have something like that right up on the screen now, correct?
Yes.
Where people could actually get a chance to see what's actually happening here.
Yes, this is a side x-ray, or we call in medicine a lateral x-ray of Cheryl's spine. And right down in through here, what we see is the artificial disc replacement, and that's at the bottom level. And that's allowed her to return to a fairly vigorous lifestyle. She's back working as a certified nursing assistant, and as you see, she was good enough to come from work today.
Yeah, thank you so much for that. So Cheryl, how long was it before you came to the doctor and got this relief? How long were you suffering?
Probably about 3 to 4 months.
Wow. Wow. And then after the surgery?
A lot better.
Yeah.
A lot better.
Yeah. Is it any restrictions still or any pain?
Well, it's not a lot of pain, not a lot of heavy lifting like right away, but I'm working there gradually, getting back to where I was.
Because this is just recent, right? How long ago was your surgery?
It's been a year.
About a year. That's
Yes.
pretty recent for
Yeah.
a spine surgery.
Yeah, it
Awesome.
is.
So you got some new parts. Did he give you like a 100,000-mile warranty on this or what?
He just told me to be safe.
Ah,
That's it. Be
that's
safe.
incredible.
Yeah.
And so but you do notice the difference.
Oh yeah, yes, very much, very much.
Anything else you want to say about that?
That I would recommend anybody to get it
Ah,
that needs it because it does help.
yeah.
The technology has been around in Europe and in other parts of the world for a little over 20 years. The FDA approved lumbar replacements in the United States in late 2004, I believe.
Wow.
The first prosthesis on the market was a little controversial, and we decided not to use that and to wait for the second generation of prostheses to come out, which is what Cheryl has. It's a very safe prosthesis. It's time-tested and really should last forever.
That's incredible. That's incredible. Absolutely incredible. And now, Dr. Capicotto, you're going to introduce us to someone who had a cervical disc replacement.
Yes.
Correct.
Yes.
Yes, I'm learning so much today. I absolutely love doing this. It's incredible. Tell me a little bit what happened in this gentleman's case.
Mr. Jorge Velasquez suffered an injury at work. It's a little complicated, and I'll let him explain that to you. And he had suffered severe pain in his neck and in his arm, similar to my patient Cheryl. Terrible pain to the point could not work, could not sleep, arms were weak, terrible neck pain, terrible headaches, and other conservative measures, which as a surgeon I would call non-operative measures,
Right.
were not successful in making him better.
Right.
He had an MRI that showed he had herniated discs, and Mr. Velasquez realized that he needed to have something done surgically. And we went through the same issues with him. He's a young man, wants to go back to work, needs to provide for himself and his family, and he elected to have an artificial disc replacement as an alternative to a spinal fusion, which is the classic operation.
Right. And before you got to that point, thank you, George, for coming and helping to educate our viewers today, because this is great information. So before you got to that point, you were trying some traditional, non-surgical ways to heal.
Yes, I went to a chiropractor, tried that out for a while, and it helped a little bit, but I still had to have painkillers, and I wanted to be able to be a person that didn't have to take pain pills, and so I wanted to try something else. So through a friend, I heard about Dr. Capicotto, and I came to him, and then we made the decision to do the disc replacement.
So you were working, but you were rear-ended.
I was rear-ended at work. I was on my way back to work, and it was during my lunch hour. And at that point is when I realized I had whiplash. Ended up in the emergency room, neck swollen, shoulder swollen. 2 weeks later, I went back to work. But it just never went away. It got worse and worse and worse. So I knew I had to have something done because it wasn't normal. It was just always bothering me. I thought it would be like a sore ankle or something like that it'd just go away, but it never did. So as time went on, came to Dr. Capicotto through a friend, and she also had surgery with Dr. Capicotto, and it was successful, so I wanted to go with a person that could get me back to work. So I enjoy my job, good place to work, so I wanted to have someone to be able to put me back at work.
That's pretty incredible. And so how was the surgery?
After the surgery, actually after the first day, I felt great. I felt the immediate difference. I didn't have any headaches. The pain going through my arm, going up my back to my head, all those things were gone the first day I felt it. So at first I thought, well, maybe it's the medication. But as time went on, I found that it was the operation itself that helped me.
You must be so excited.
Oh, I am.
Yeah, I'm going to ask you the same question I asked Cheryl, too. Did you get a 100,000-mile warranty with these new parts?
Lifetime.
Very good answer. Very good answer. That's awesome.
I think it will last him a lifetime. I really do. Similar to hip and knee replacements, the longevity of the replacements has been improving over the years. And the materials used for the artificial disc are the same as in an artificial hip and an artificial knee. And they last a long time. So I'm very optimistic that this will last him pretty much forever.
That's absolutely incredible. Okay. Well, so once again, we're giving you the information to give you the power so that you can get to your doctors to ask the questions, to get you to the doctor, to get new replacement parts rather than fusion as a possibility so that you could then enjoy your life fully. And George, we just thank you so much for coming and sharing. You know, you are very much of an encouragement to others who are listening.
It was a pleasure, especially if someone else can have this done and be given their life back to them. It's a good way to go.
Unlike Cheryl, it's a little difficult, but to ask Cheryl for her to show her range of motion. But maybe George would be good enough to show us how good his neck moves.
And I have to say that this is after the first day coming out of surgery. I was already doing this.
Oh my goodness.
Whereas before, I was
First day?
right out of surgery.
Wow. And prior to surgery?
Prior to surgery, I was having a hard time. In fact, if I put my neck back, I'd almost pass out.
Wow.
You know, so range of motion was bad.
Wow.
So even side to side was bothering, but especially going back like that. Whereas now, I have no problems.